So immediately post-embryo transfer, we usually advise a rest of 15 to 20 minutes for the patient. And then because the procedure is done with full bladder, she can go to the washroom, empty the bladder, and then she has to take all the medicines that are prescribed to her on a timely basis. And even the diet, she can follow the normal diet that she consumes daily. And there is no requirement for any fasting. And typically we advise them to avoid pineapple and papaya after the embryo transfer. Post-embryo transfer, we advise moderate amount of home rest for 2 to 3 days, because once we transfer the embryo, it moves around within the cavity and finds a conducive place for it to get implanted, and implants in 2 to 3 days after embryo transfer. So moderate amount of home rest would help in this process, and post that they can resume their normal activities, but they have to make sure that they don't exert themselves excessively, either physically or mentally. And it is easier said than done, because post-embryo transfer they would be anxious about the result, but then anxiety would only cause harm rather than causing any advantage. So they have to be stress-free, and they can take the help of meditation or do breathing exercises to reduce the anxiety and the stress. Many of the patients, they even have a query whether they can travel immediately post-embryo transfer. So if it is a short distance with good road services, then they can travel the same day. But if they have to travel a long way, or if they have to take a flight, then it's better they postpone that for 2 to 3 days, take some rest, and then go ahead with the travel. And during the travel, they have to take certain precautions, like they have to void the unit frequently to prevent any urinary tract infection. They have to consume proper home cooked food or any safe food, and maintain proper hydration during the travel, and avoid crowded places so that infections can be prevented. And some people even have certain queries whether they can take stairs after the embryo transfer. So they can definitely climb stairs after the embryo transfer, but they shouldn't exert themselves during the climbing. So in case if there are more number of stairs, then they can take a break in between and climb the rest of the stairs. As already discussed, nothing specifically needs to be done after embryo transfer except to ensure physical and mental rest. That is not complete bed rest or anything, but they shouldn't exert themselves physically or mentally after the embryo transfer, and they have to take all the medicines on time and ensure that they are stress-free. Post-embryo transfer, they can consume the normal routine food that they can have it, but then they have to ensure taking more of balanced diet, which has more of fresh fruits, vegetables, and the naturally colored foods, which have more of antioxidants, vitamins and minerals in them. They have to avoid oily, spicy, outside food, then even the highly refined carbohydrates or artificial sweeteners post-embryo transfer. And certain foods like nuts, like almonds, cashews, then they have more of omega-3 fatty acids, and even the pumpkin seeds, chia seeds would help them. And consuming berries also would help them because it has a lot of vitamins, minerals and antioxidants in them. They can avoid certain food like the red meat, but white meat can be consumed in moderation after the embryo transfer.